Welcome to Module 3. This is the third installment in the Emerging Infectious Disease Videos for Pre-Hospital Providers series. In this video, we will be discussing the fundamentals of personal protective equipment using the multi-pathogen approach. This instructional series was created by the University of Maryland, Baltimore County Department of Emergency Health Services with assistance from the Maryland Department of Health and funding from the U.S. Centers for Disease Control and Prevention. In this module, we will describe the various types of personal protective equipment, or PPE, and provide information on the selection and use of PPE in the pre-hospital environment. We will review the principles of standard precautions, formerly called universal precautions, and the multi-pathogen approach to infection control precautions. In addition, you will gain an understanding of the appropriate implementation of transmission-based precautions, including contact, droplet, airborne, and special respiratory precautions. Finally, this video will introduce the basic principles of Ebola virus disease PPE and precautions. Personal protective equipment, or PPE, refers to a variety of specialized clothing and equipment, including gowns, gloves, masks, and respirators that are used alone or in combination to prevent contact with the infectious agent or bodily fluid that may contain the infectious agent, thus creating a barrier between the worker and the infectious material. Selection of PPE is determined by patient interaction, the patient's signs and symptoms, the most likely mode of transmission, and any pertinent history, such as a current infectious disease outbreak to which the patient may have been exposed. Remember, in Module 2, we spoke about the multi-pathogen approach to deciding what types of PPE to select. This helps us make good PPE decisions without having to know which pathogen or pathogens a patient may have. This process helps make good decisions before you are one step too late. PPE selection should be determined by the provider's on-scene assessment of signs and symptoms and the suspected disease transmission process. Every infectious disease should be approached with a minimum of standard precautions consistent with the level of risk. Hand hygiene is one of the simplest and most effective methods of preventing the transmission of infectious pathogens from person to person. Effective hand washing is performed by wetting hands with warm water and lathering with soap for at least 20 seconds. Be sure to thoroughly lather the backs of your hands, in between your fingers, and under your nails. Rinse your hands under warm water and dry with clean paper towels. It is very important to wash your hands before direct contact with a patient, before putting on gloves, after contact with blood or bodily fluids, mucous membranes, non-intact skin, or wound dressings, after contact with a patient's skin, after contact with inanimate objects in the immediate vicinity of the infectious patient, after removing gloves, after transfer of care at the hospital, and after cleaning and disinfecting the ambulance. Remember to also wash your hands before you eat and before you go home at the end of your shift. This will help protect your families and loved ones from potential exposure to pathogens you may have come in contact with at work. If soap and water are not available, alcohol-based hand sanitizer should be used in the field. However, providers should wash their hands with soap and water at the first available opportunity. Alcohol-based hand sanitizers are not effective against certain kinds of pathogens, such as C. diff. PPE that should be used when implementing standard precautions include exam gloves to protect providers' hands from contamination, goggles or a face shield, and a surgical mask when performing airway procedures to protect the provider's eyes, nose, and mouth from airborne agents. An impermeable gown will protect a provider's skin and clothing from any situation that may result in splashing or exposure to contaminated blood or bodily fluids. In all instances of patient care, pre-hospital providers should ensure proper decontamination of all surfaces of patient contact, appropriately dispose of contaminated non-reusable materials, and attempt to provide a surgical mask to patients with a cough who can tolerate it. Remember to decontaminate any surfaces you may have touched while wearing contaminated gloves. Oxygen bottle valves, cabinet doors and drawers, and door handles are common sites where we find microbial contamination. It is also important to remember that reusable eye protection, like glasses or goggles, should be cleaned with disinfected wipes or a 1 to 10 bleach solution between patients. This prevents protective gear from becoming a vehicle for infectious agents. Further information on decontamination methods will be covered in future modules. Contact precautions are used for patients who are suspected of having a disease that spreads through the contact transmission mode. These precautions are intended to prevent the spread of highly contagious pathogens such as MRSA, C. diff, infected wounds, norovirus, vancomycin-resistant enterococci, or VRE, other infectious diarrhea, and lice or scabies. Signs and symptoms to be aware of for contact precautions include vomiting or diarrhea, rash, draining wounds, and history of previous antibiotic-resistant infection. EMS providers should be aware of any area or community-based outbreaks of norovirus or other epidemic diseases requiring contact precautions and should obtain relevant history as indicated by patient assessment. Providers should use gloves, eye protection, and consider wearing a gown for patients with vomiting, diarrhea, bleeding, or a rash. As soon as possible, pre-hospital providers should wash their hands with alcohol-based hand sanitizer, followed by soap and water.
It looks like the last time you got MRSA.
Okay, with the history of MRSA, we should probably gown up.
Yep. Can you tell me about the time you started having MRSA?
I'm not sure. I don't remember.
Okay. Is he alert and talking to you?
Mm-hmm.
Okay. We're just going to put these on for our safety.
Okay.
And you said he's had it before. When was the last time he had it? Do you know?
I can't remember.
Okay. Has it been more than once?
Yeah.
Okay.
Good.
Yeah.
Well.
When providing care to a patient who requires contact precautions, pre-hospital providers should consider performing the following actions in order to reduce the risk of disease transmission. Provide antiemetics, provide emesis bags and towels as able, notify triage upon arrival at the hospital of vomiting or diarrhea, and ensure proper decontamination of all patient contact surfaces. If contamination of ambulance surfaces is such that it is impossible to clean adequately between calls, the unit should be returned to the station and taken out of service until a thorough decontamination can be completed. Droplet precautions are used for diseases that spread through droplet transmission methods. Some infectious diseases, like seasonal influenza and strep throat, spread from person to person in respiratory secretions that are expelled when people talk, sneeze, or cough. Signs and symptoms to be aware of for droplet precautions include cough or other respiratory symptoms and fever. Example diseases include Neisseria meningitis, streptococcal pneumonia, and seasonal flu, among others. Droplet precautions are intended to provide additional respiratory protection against droplet disease transmission from patients to providers. All providers should wash their hands before and after patient contact when able. If soap and water are not available, providers should use alcohol-based hand sanitizer. Droplet precautions include gloves, a face mask, and eye protection. Some jurisdictions may include a gown for droplet protection. These should be used anytime a patient is coughing or receiving an airway procedure. Personnel not in droplet protective equipment should maintain a distance of at least 6 feet from the patient. In addition to previously mentioned precautions, be aware that nebulizers increase droplet generation and result in the need for airborne precautions. Additional actions may be helpful. For example, the use of metered dose inhalers do not increase droplet generation and should be used when tolerated by patients. To the degree possible, minimize airway interventions that may cause coughing. Consider isolating the driver compartment and having the patient compartment exhaust vent on high if performing aerosol-producing procedures such as suctioning, intubation, nebulizers, and chest compression.
Thank goodness you're here. My roommate, she's been having a lot of trouble breathing. Please help.
Okay, before we come in, can you tell us if your roommate has a fever?
No, she just been having chills.
Okay. All right, let's get mask on just before. There you go.
You feeling all right?
Yeah, I'm okay.
All right. Ready? When providing care to a patient who requires droplet precautions, pre-hospital providers should consider the following actions in order to reduce the risk of disease transmission. Provide a surgical mask for all patients with acute infectious respiratory symptoms who can tolerate it. This simple step has been found to significantly decrease airborne droplets. Ensure proper decontamination of all surfaces of patient contact and disposal of contaminated, non-reusable materials. When pre-hospital providers suspect a patient is infected with an airborne transmissible disease, airborne precautions should be implemented. Airborne precautions are intended to protect providers against infectious pathogens that spread through the airborne transmission mode. These pathogens remain infectious over long distances when suspended in the air. Signs and symptoms to be aware of for airborne precautions include cough or other respiratory symptoms, fever, or a rash. Some examples of diseases that require airborne precautions include measles, tuberculosis, chickenpox, disseminated shingles, and novel influenza. In order to use the most appropriate PPE, pre-hospital providers should be aware of any area or community-based outbreaks of diseases that require airborne precautions such as measles or tuberculosis. Providers should wash their hands before and after patient contact when able. In addition to eye protection, gloves, and gowns, providers should wear an N95 fit-tested respirator or powered air purifying respirator called a PAPR with a full hood and HEPA filter. Providers' self-assessment of protective equipment is an important part of infection control in the pre-hospital environment. Providers should be appropriately fit-tested for their N95 mask on a yearly basis, be up to date on vaccinations, and have appropriately sized gloves and gowns ready for use when needed. In addition, the driver compartment should be isolated and the patient compartment exhaust vents should be set on high. If the driver compartment cannot be isolated, the driver should also wear a respirator. Intubated patients who are suspected of being infectious or febrile should be ventilated with a bag valve mask device or a ventilator equipped with a HEPA filter when available. When providing care to a patient who requires airborne precautions, pre-hospital providers should consider the following in order to reduce the risk of disease transmission. Ask patients with a cough or fever to wear a regular surgical mask if they can tolerate it. If clinically indicated, rapid sequence intubation should be considered for patients requiring definitive airway management to avoid excessive bagging. Remember to increase PPE level to airborne or use a N95 or other respirator when performing intubations or breathing treatments on patients with a fever or those suspected to be infectious. Notify the receiving hospital of the possible need for an airborne infection isolation room for patient placement. All right, how about we give her a neb treatment and let's switch our mask to the N95.
Sure.
Okay. All right, ma'am, we're going to be giving you a neb treatment, and just because of the procedure, we're going to be switching our masks, okay? How long ago did you say this started?
About 3 hours.
3 hours, okay. The following procedures require airborne precautions for any patient with a recent history of infectious respiratory symptoms if known. Endotracheal intubation, airway suctioning, nebulized breathing treatments, CPAP or BiPAP, or CPR. Special respiratory precautions are intended to protect providers coming into contact with individuals with known or suspected high-consequence diseases known to be highly contagious from person to person. Some examples of diseases that require special respiratory precautions include severe acute respiratory syndrome, or SARS, Middle East Respiratory Syndrome, or MERS, novel flu, and multi-drug-resistant tuberculosis, just to name a few. These precautions provide respiratory protection from inhalation of airborne infectious pathogens as well as an impermeable barrier to prevent transmission of highly pathogenic infectious agents through direct or indirect contact with patients and their environment during patient care. Special respiratory precautions include the use of gowns, masks, respirators, shoe covers, and double gloves. In the case of a patient who requires special respiratory precautions or who is suspected of a high-consequence disease such as MERS or novel flu, pre-hospital providers should attempt to minimize the number of direct caregivers who interact with the patient. If the patient is stable and verbal, doorway evaluations at a minimum of 6 feet distance should be performed by one provider while others don appropriate PPE. In these instances, providers should use additional screening questions including patient-specific travel history and any potentially related exposures. As always, pre-hospital providers should perform hand hygiene before and after patient contact. Special respiratory precautions PPE includes a PAPR with a full hood and HEPA filter or a fit-tested N95 respirator with face shield or goggles, a disposable fluid-resistant gown that extends to at least mid-calf, or a disposable fluid-resistant coveralls, disposable double gloves, and boots or shoe covers. When providing care to a patient who requires special respiratory precautions, pre-hospital providers should consider the following in order to reduce the risk of disease transmission. Ask the patient to wear a surgical mask. Exercise caution when performing aerosol-producing procedures. Only perform these procedures if they are absolutely necessary. Notify the receiving hospital of the possible need for special respiratory precautions or an isolation room. Special respiratory precautions should be used when there is a suspected community transmission of EIDs such as avian flu, MERS, or SARS. New information regarding these diseases may come from your local health officials, news outlets, or jurisdictions. The precautions described in the following slides are for patients with known or suspected Ebola virus disease or other viral hemorrhagic fever exposures or a travel history in countries with known EVD VHF outbreaks. Symptoms of EVD include fever, headache, vomiting, muscle pain, or unexplained bleeding. The fever, headache, vomiting, and muscle pain are unfortunately common in many other diseases. Adding the unexplained bleeding makes it more likely that the patient may have an extremely dangerous Ebola virus disease or viral hemorrhagic fever. It's important to know that different types of exposure to someone with Ebola can make a big difference in the risk of the disease being transferred to you. The highest risk is carried by people who come in direct contact with the body or bodily fluids of someone who has Ebola or has died from it. Donning appropriate PPE minimizes the risk but does not totally eliminate it. You can also be exposed by being in a common space with an infected person, such as in an airplane or in the back of an ambulance, even if you are not taking care of the patient. Persons who were exposed to Ebola more than 21 days ago and have not become ill themselves are not considered to be infectious. Your dispatcher may provide you with a patient history concerning Ebola exposure prior to the arrival at the scene. During your doorway assessment, be sure to ask about symptoms and travel history before initiating contact with the patient. If you believe Ebola precautions may be necessary, contact medical control in accordance with your protocols. Dispatch and medical control will ensure that receiving hospitals are made aware of the patient's status. Patients with suspected Ebola exposure who are not bleeding or vomiting are considered dry patients. PPE for these patients include double gloves, fluid-resistant gowns that extend to the mid-calf, respirator, splash-rated goggles, and fluid-resistant shoe covers. Patients with suspected Ebola virus disease who also have bleeding or vomiting are considered wet patients. These patients require a higher level of PPE than dry patients, which includes extended cuff gloves, single-use gowns that extend to mid-calf, single-use hood that fully covers the head, neck, and shoulders, a fit-tested N95 or other respirator, a full face shield, and fluid-resistant boot covers. Jurisdictions may also decide to employ a fully integrated suit such as the one shown here. The donning and doffing of PPE for Ebola patients, as well as equipment decontamination, can be detailed and complex. In addition, caring for this type of patient requires a team approach, and jurisdictions may require multiple practice drills to ensure competency and confidence in their donning and doffing skills. We will cover this content in more detail in future modules. The pre-hospital environment is often unpredictable, and it can be difficult to determine which level of PPE is appropriate for patient care. The multi-pathogen approach to PPE is a process by which healthcare providers utilize the available patient history and presenting signs and symptoms to determine the most likely mode of disease transmission and the level of PPE to don without definitive knowledge of the specific pathogen. In the pre-hospital environment, we do not always know what diseases our patients have, but we can always protect ourselves by making an educated choice. The multi-pathogen approach is an important tool for pre-hospital providers to identify the level of PPE required based on the patient's presenting symptoms and history. For example, patients with fever, cough, and recent travel to the Middle East may need special respiratory precautions for MERS. Wearing the appropriate level of precaution will ensure that you are protecting yourself, your patients, and your community. Thank you for joining us for Module 3, PPE Considerations for Pre-Hospital Providers Using the Multi-Pathogen Approach. There are additional resources in the slides below for your review. In our next module, we will cover the donning of PPE.